Pregnancy brings about significant changes in the reproductive system to support the growing fetus and prepare for the childbirth. Some physiologic changes in the reproductive system during pregnancy includes, first is the uterus enlargement, cervix changes, increased blood supply, hormonal changes, breast tenderness or breast changes, vaginal discharge, and lastly is the ovarian changes. Ovulation ceases during pregnancy due to the hormonal changes. It is important to note that these changes are normal during pregnancy and healthcare providers closely monitor them to ensure a well-being of both mother and the baby. Moving on to the physiologic changes in the integumentary system, which include the skin, the hair, and also the nails. Some of these changes include the hyperpigmentation. Usually, we can observe it to the underarms, to the neck, and inner thighs of the pregnant mother. Next are the stretch marks, hair changes, acne, nail changes, spider veins, and lastly is sweating. So it changes vary from person to person, and most of these changes are temporary and usually resolve or return to normal after pregnancy. However, it is always important to discuss any concern with a healthcare provider. Respiratory system. Pregnancy also brings several physiologic changes in the respiratory system to accommodate the needs of the growing fetus. It includes the increased respiratory rate due to the pressure on the diaphragm. Second is the increased oxygen consumption for the mother need to deliver more oxygen to support its development. Third is the decreased lung capacity since diaphragm is pushed upward. And lastly is the fourth, increased blood volume, which requires the respiratory system to work harder to oxygenate the blood of both mother and the baby. Now, in terms of skeletal system, there are changes that are also common during pregnancy. First is the increased joint flexibility. The hormone relaxin is released during pregnancy. For this help the fetus to have room and allow for easier passage of the baby during the delivery. Second is the shift in the center of gravity as the fetus grows. The mother's center of gravity shifts forward. Third and the last is the increase of the osteoporosis as the mother's body requires a significant amount of calcium for fetal development and breastfeeding.
So the varicosities is usually the harmless part of pregnancy for some women. So the large vein, which is the inferior vena cava, that carries blood back to your heart from your feet and legs. So also the varicose veins can become itchy, uncomfortable, or even painful, but rest assured that it will come off after your pregnancy. So the varicosities doesn't have that complications because it is harmless to the pregnant woman. So for the nursing implementation for the varicosities, number 1 is to change the positions of the client to avoid long periods of sitting or standing. So number 2 is to don't sit with legs crossed. So number 3 is to put the feet up several times in a day. And number 4 is to sleep on the left side of the position of the bed. And then number 5 is to wear maternity pantyhose or decompression socks to avoid the varicosities. So during pregnancy, muscle cramps is very common, especially on the second and third trimester of pregnancy. So for the complications, so muscle cramps during pregnancy are typically common discomfort and are not usually associated with severe complications. And some of it are number 1, sleep disruption, number 2, electrolyte imbalance, number 3 is decrease in physical activity. So for the nursing implementation, we have here, number 1 is to advise the elevating the legs when resting, as this can improve circulation and reduce the risk of cramps in the legs. Number 2 is to advise the client on wearing comfortable and supportive shoes and avoiding standing for long periods of time. And lastly, we need to encourage the pregnant person to maintain a good hydration by drinking an adequate amount of water. So the discomfort of pregnancy refers to all temporary symptoms and changes that the pregnant client experiences as their babies grow and develop within their uterus. So on the first trimester, you may start to feel extremely tired, moody, and sore in places like your breast, and you may get headaches, feel unsalted, and find you to pee more often. And for the second trimester, the fetus grows, so does her body. You may also start to feel more aches and pains and pressure and stretching. You may notice swelling and stretch marks around your body. And for the third trimester, the added weight places pressure on your joints, bladder, and gut. You may notice new aches and pains and struggle with heartburns, constipation, and dribbling pee. You may feel out of breath easily when you're active because your growing uterus is pushing against your diaphragm and your lungs. So for the complications, number 1 is we have your pregnancy discomforts, and if not managed or if they worsen, can sometimes lead more serious complications, like number 1, dehydration, number 2 is preterm labor, number 3 is vaginal or urinary tract infections, and number 4 is blood pressure issues, and lastly, for the anemia. For the nursing implementation, number 1 is to maintain and monitor the hydration to prevent the dehydration of the client. Number 2 is to teach the pelvic floor exercises, or also known as Kegel exercise. Number 3 is to provide education on proper bra fitting and selection. And lastly, we have to discuss the good sleep hygiene and relaxation technique, or to prevent the insomnia of their client. So hypotension is a common phenomenon during pregnancy, which usually occurs during pregnancy because more blood is being routed to the fetus. So also, readings will elevate during labor, fluctuate slightly after delivery, and return to the normal in postpartum. So let us now move on into the nursing implementation for the hypotension. So letter A, our first one, is we have to position the patient on her left side because this relieves the uterine pressure on the inferior vena cava and iliac veins, and it increases oxygen supply to the uterus or to the fetus. Letter B is to administer oxygen per face mask, usually at the 5 to 8 liters per minute as ordered by the doctor. And letter C is to elevate the patient's legs. And for the fourth one, or letter D, we have to stay with the client and do not leave her unattendedly. And for the last one, we have to notify the charge nurse or physicians immediately. So on temperature, it is common for a woman's body temperature to change during pregnancy. And also, if you're pregnant and your body temperature goes above 39 degrees Celsius, there is a risk for birth defects and pregnancy problems, especially during the first trimester. So for the complications, so later in pregnancy, it can lead to dehydration, heat exhaustion, or heat stroke in the mother. So for our nursing intervention, we have here to remove the excess clotting of the patient, ensure the patient is in a cold environment, also encourage the patient to drink water, and lastly, educate the patient about heat loss.